Welcome everyone to today's session of our Now program educational webinars. Today's topic will be brain health and cognitive preservation. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the Now team for this continued partnership. The recording of the session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat and Q&A feature throughout the session. At the end of the session, your questions in the chat will be used to moderate the question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to Rachel Garcia Fox to introduce our panelist.
Thank you so much. Hi, everybody. Thanks for joining today. Welcome to a new Neuro-Oncology Wellness Education webinar. The Neuro-Oncology Wellness Program, or the NOW program, is an initiative from the Center for Neuro-Oncology at the Dana-Farber Cancer Institute with a mission to educate patients and their caregivers about brain tumors, as well as provide resources to promote overall health and well-being. My name is Rachel Garcia Fox. I serve as the program administrator for NOW, and I'll be your host for this webinar. Today, I'm excited to be joined by Dr. Joseph Kim for a discussion on cognitive preservation in brain tumor patients. Dr. Kim is a neuropsychologist at Brigham and Women's Center for Brain-Mind Medicine. He trained at Vanderbilt University, Duke University, and the University of Utah. And he specializes in assessing cognitive and psychological functions, as well as developing treatment plans. Dr. Kim, thank you so much for joining us today.
My pleasure.
Before we start, I just want to remind our audience again that we want you to be a part of this conversation. So please do submit your questions via the Q&A feature at the bottom of your Zoom screen. As a reminder, there is a chat feature and a Q&A feature for any questions that you're hoping to get answered today. Please use the Q&A feature. We'll select a number of questions for our guests to answer at the second half of the program. So Dr. Kim, as we like to do on all of our webinars, let's start with some basic definitions. What exactly is cognition? Help us understand this term in the broader context of brain function, if you don't mind.
Sure. Cognition refers to all of our mental processes that are involved in gaining knowledge and understanding. And this includes things like thinking, remembering, making decisions. Our brain is like a complex city with different neighborhoods responsible for different tasks. So for instance, our frontal lobe is like the city's planning department, or the executive branch, handling complex tasks like decision-making or problem-solving. And our temporal lobe is akin to library, storing and retrieving memories and dealing with our language function. And when these areas work well together, you can easily remember where you put your keys or plan your day. But if these areas are damaged or affected, these tasks can become more challenging.
Wonderful. Thank you for that metaphor. It's actually very helpful for starting to understand kind of the different areas of the brain, as we'll, I'm sure, get into more and what they all do. Thank you. How do cognitive abilities change over our lifetime?
Our cognitive abilities evolve as we age. Similar to how a garden might change with the season. So in our youth, in our childhood, our cognitive garden is very lush and vibrant and very young. So we can learn quickly and recall information more effortlessly. As we age, we may notice that things don't go as quickly. For example, it might take longer for us to recall someone's name or to focus on a task. These changes are normal, but staying mentally active through activities like puzzles or learning new skills can certainly help keep our cognitive skills healthy and flourishing. Now, There are some known changes as we age that are normative. So I did mention taking us longer to recall names and memories. That is to some degree normal. And as we age, not all things decline. Actually, our word knowledge and our crystallized, what we call crystallized intelligence, our lived-in wisdom and experience that inform us to make better decisions, those things actually accumulate and get better over time. So some things may decline and other things may improve with aging.
Very interesting. With this context in mind, can we think a little bit about how neurologic disease, like a brain tumor, would impact cognition? You mentioned aging. What about something like a brain tumor?
Sure. So brain tumors can disrupt our thinking and cognitive function in several ways. Imagine our brain like a finely tuned orchestra. A tumor can act like an unexpected, instrument being added, which throws a whole performance off. It may evade or put pressure on specific areas of the brain, leading to difficulties in thinking or our memory, depending on where uh, the tumor affects the brain more. So tumors can also interfere with our brain's wiring or connections between areas, affecting communication across different areas of the brain. So for instance, if the brain tumor is in the frontal lobe, you might struggle with organizing tasks or making decisions. Additionally, there are some things that co-occur with brain tumors like seizures or changes in mood that can further exacerbate and complicate our cognitive problems.
And in addition to deficits that are provoked directly by the tumor, are there any other effects that could be expected in brain tumor patients, maybe with treatment, for example?
Yeah, absolutely. Treatments like chemotherapy or radiation therapy that are common uh, with brain tumors can also impact cognition. For example, chemotherapy can cause what's commonly referred to as chemo brain, where patients experience memory problems, difficulty concentrating, or mental fog. Imagine it like a heavy fog rolling in and making everything seem kind of unclear. And radiation therapy can also affect our cognitive function by causing inflammation or damage to healthy brain tissue that are unintended effects, side effects of the treatment. And that can sometimes lead to more long-term issues like slowed processing of information or memory difficulties as well. So both treatments can make daily tasks like managing appointments or following a recipe a bit more challenging, although many people do recover from some of the acute effects of the treatment afterwards.
Great to know. Thank you for that answer. Um, Many of our brain tumor patients are of the ages where cognitive decline may be noticed, just because of aging. This we hear a lot from our patients, wanting to know kind of, is it normal, just regular cognitive decline, or is this, my brain tumor that's causing these changes? I'm wondering, is it possible to differentiate the effects of a brain tumor and treatment, as you mentioned, and, something that's more kind of typical with normal aging or a kind of different process impacting cognition?
Absolutely, yeah. It's like differentiating between kind of uh, maybe to borrow analogy of, a car, when you have a new car, it's, running very efficiently and well. But there is also kind of a normal wear and tear that makes the car a bit less efficient, although it's still well functioning. So aging can be thought of as that kind of normal wear and tear, whereas, you know, uh, neurological diseases or tumors and maybe treatment related changes could be likened to more of different kind of malfunction in specific parts that causes abnormal function. And doctors can use a combination of tests and observations to diagnose this. So for example, if cognitive decline is more rapid and severe, it might be more related to the tumor or its treatment rather than normal aging. And a detailed neuropsychological testing can also help us understand the specific nature of different kinds of cognitive changes, whether this is normal aging related or something that is below expected, even taking into account the aging, allowing for a more accurate diagnosis and targeted interventions.
Great. Yeah, I definitely want to hear a little bit more about that. And just to kind of recap, it sounds like normal aging processes impact on cognition. It's going to be kind of a gradual, slow change, and something that deviates from that, like a dramatic change. That might be something where there's an underlying cause, either something that could be a tumor or another neurological disease. Does that sound right?
Yes, absolutely.
Great.
Yeah.
And neuropsychological testing. This is something that I know many of our patients are either curious about, or some may even have already had neuropsychological testing. Can we just talk a little bit more about kind of the background on neuropsychological testing, how you conduct it, and then what a patient could expect if they were going in for an evaluation?
Absolutely. So neuropsychological testing is like a detailed inventory of our brain's capabilities cognitively. So it involves going through a series of tasks and questions that are designed to assess different aspects of our cognitive function, such as attention, memory, our language skills, visual spatial perception, even our motor dexterity, and sometimes problem solving and other parts of the executive functioning. For example, you might be asked to remember a list of words or complete visual puzzles. And the results help us understand how different areas of the brain are functioning and where support might be needed. It also helps us understand each person's strengths and weaknesses from which we can build and tailor recommendations on what would be helpful for that person to compensate or get more support. It is a non-invasive process and typically involves a few hours of testing, 2 to 4 hours of testing over one, sometimes rarely, but sometimes more sessions.
Thank you for giving that overview. I'm thinking back to that city metaphor. You might have a library that's running really, really well, but maybe there's some trouble at City Hall, for example. So it sounds like you're really assessing the different domains, different areas of function. It's
Mhm.
fascinating that, you can break them down in such a way. Do you have any insights on the results of neuropsychological testing and how they can help a neuro-oncologist or another provider with managing cognitive problems, specifically in brain tumor patients? No, it's a big question, but just curious to hear your thoughts on that.
Yeah, absolutely. So results of the neuropsychological evaluation can provide a more detailed map of a patient's cognitive strengths and weaknesses, like I mentioned earlier. Whereas generally, when a patient shows up in the clinic, they may, have complaints of, I just feel generally foggy and I have some memory issues. And so having a more detailed objective measure of these difficulties can get a better sense, more precise sense of what areas of the brain is working well, what areas are needing more support. So for instance, if the testing shows difficulty with memory, but preserved problem-solving skills, a neuro-oncologist can tailor recommendations to address these specific areas. And this might include something like cognitive therapy or memory aids or adjustments to daily routines. And these kinds of insights that you gather from the neuropsych assessment creates a personalized plan to improve cognitive function and overall quality of life.
Wonderful. So you mentioned a lot of different interventions that can target different areas. Can you actually improve cognition through the implementation of these recommendations?
Yes, absolutely. There's a lot of research that has been done and ongoing that shows that cognitive changes, including related to tumor resection and treatment, can be helped, can be supported to improve that. So they can be often improved with the right interventions. The extent of recovery, of course, can vary depending on the individual and the nature of the cognitive issues. But many patients do benefit from cognitive rehabilitation. So, for example, structured cognitive exercises and memory training has helped many patients improve skills like organization and recall. It's like retraining a muscle that's been weakened, almost like going through physical therapy and regaining your strength. And with practice and appropriate support, patients can see meaningful improvements.
Wonderful. Thank you for explaining that. I want to just repeat for everybody in the audience the terminology he just used, cognitive rehabilitation. I think that is a term that is really good to know if it's something you're interested in, addressing in your own experience. It's something that, a neuro-oncologist can refer you to, or a neuropsychologist. So thank you for bringing that up. It's a great resource for our patients. And there are many other resources as well, and you mentioned a number of them. In your experience and to your knowledge, what are the most effective measures for cognitive preservation specifically?
So key things to keep in mind to preserve our cognitive function generally include a lot of the things that you hear from all of the doctors that you go see, right? And the recommendations are pretty standard. It's maintaining good sleep, regular exercise, a good healthy diet, all of those things. So good sleep is really essential and something that I want to highlight because it really helps our brain not only consolidate our memories and refresh itself. It really has some key function that clears toxins in our brain. Literally, when we're asleep, the brain is clearing toxins in our brain. So without that adequate sleep, we can have some difficulty maintaining optimal function during the daytime. Regular exercise also, especially aerobic activities like brisk walking, swimming, can enhance blood flow to the brain, delivering fresh oxygen to the brain supports our overall cognitive health. And so what I tell my patients is that if a healthy diet and exercise was in the form of a pill, everyone would be paying thousands of dollars to get that because it's there's such a consistent evidence in research that shows people who are more active shows good long-term brain health, long-term outcome from brain health. So that's really an important factor.
Great. Yeah, it sounds so simple when the recommendations are given, but it might be harder to actually get that consistent sleep and exercise. Like you said, a pill would definitely be something people would be interested in if it were available. It's fascinating to hear too about that toxins are cleared from your brain while you're sleeping. I actually had no idea. And that's very interesting. Before we move on, I wanted to pause and just remind the audience that in a little while we'll be answering questions that are in the Q&A. So please take a moment if you have something that you think you want to ask and just type it in there. Dr. Kim, I'm glad you brought up exercise. I just want to also remind our viewers that we have a two-part series on exercise that our director, the now program director, Dr. Gonzalez Castro did. And that's specifically exercise for brain tumor patients. So we highly recommend that people look into that. Let's talk a little bit more about diet and supplements. I think you mentioned Mediterranean diet maybe, but can we hear a little bit more about your thoughts on diets and even supplements for cognition?
Absolutely. A balanced diet is a critical factor that does impact our brain health. So there's a lot of now research on like the Mediterranean diet or the MIND diet, which really supports brain health. So these diets are typically rich in fresh produce like fresh fruits and vegetables, more whole grains than, simple or processed food and carbs, more healthy fats like olive oil and nuts. And these all provide the essential nutrients for cognitive function. As for supplements, this is a very common question that a lot of my patients also bring up, because there are a lot of things on the market. You're bombarded by all these ads that says, oh, to promote your brain health, take this pill and you'll be better, right? While some might be helpful if you have specific deficiencies, many of these products marketed as memory boosters or cognition enhancers lack solid scientific evidence. So they can also commonly include ingredients like caffeine, which may offer a temporary boost in your alertness, but don't really address the underlying cognitive issues. So it's always best to consult with your healthcare provider before starting any new supplements.
Thank you for mentioning that. I think that's definitely good advice. If you see something, a commercial or something, even if it's like over the counter, always good to consult a doctor, even your primary care, just somebody that, can help look at the data like Dr. Kim is mentioning. Somebody in the audience asked about a particular supplement, or this may be a medication or a supplement that may have been advertised as a helping memory. Prevagen, is that something you've heard of? They're just wondering about it. I wonder if you have any thoughts on Prevagen.
I think that's a name of a supplement that is pretty popular amongst patients. I think there are some different kind of proteins and also vitamin D that's included. I think there is limited research to suggest that this definitively improves cognition or memory. And so I would say it doesn't hurt if you see some benefit to continue taking it. But I would definitely consult with your own PCP to make sure this is safe for you to take before either initiating or continuing to take.
Thank you. And then another question that's kind of related in this wheelhouse that we're talking about now. I'm just going to ask now, thoughts on the ketogenic diet for cognition? Big popular diet.
Yeah.
Keto.
So I would say ketogenic diet has been a huge fad recently with limiting carb and all that. So with respect to tumor patients, I think there is some beneficial effect, especially if those ketogenic diet can help with underlying seizure disorder secondary to the tumor tumor-related kind of cognitive changes. At the same time, it's really important to think about a more balanced diet that is overall healthy and well-rounded. So limiting certain nutrients may or may not be in the best interest of your overall bodily health and your brain health. So it really depends on the person situation whether that would be helpful or not. So I would ask that you consult with your neurologist or your prescribing physician to make sure this is a healthy diet for you in your situation.
Great, thank you. Yeah, I think, in our clinic, people are not quick to answer the question, what should I be eating? I think we kind of, leave that to nutritionists. But I do think if a provider is going to mention a diet, Mediterranean typically is what is recommended by our doctors here. So it sounds like the recommendation is consistent with that. Before we go into answering some more questions from the audience, I love this part of the webinar, hoping you can take a moment to tell us about any research projects that you're working on and any developments that we can expect in the field in the coming years.
Absolutely. So we're working, so we as in our Renew group, which is the intervention group at the Brigham and Women's in neurology, we're working on a new program that's aimed at practices and exercises that enhance executive functions like planning and multitasking, which is crucial for daily life. And so these programs aim to provide patients with more strategies to better manage their cognitive challenges and improve their overall quality of life. So we have some ongoing projects that are very exciting, that are in the beginning stages. And also, as part of our clinical program, we are studying the effectiveness of our most commonly used cognitive rehabilitation program. And the one that we use is called goal management training. There's a lot of evidence behind it. But now what we're doing is we're looking at how well these programs work, and also identifying which factors predict success and for whom this works well or better than others. So we can offer more of a personalized, tailored recommendation for patients looking to improve their memory and thinking.
Wonderful. Yeah, I'm going to put in the chat in a little bit the group that Dr. Kim works with, a Renew group, just so people know about it. And I think you guys have a pretty great website. I'll try and find it and I can link it for people before we end the webinar. And you mentioned the groups that you're running. So it sounds like your research is looking into kind of the impact of the groups and who they're best for, which is really great to hear. I know we've had several patients, more than several, complete some of those groups. And the GMT, or the goal management training group, I know some people have gone to that one specifically and have good experiences. I just want to let everybody in the audience know that, if you're a patient at the Center for Neuro-Oncology and you're interested in being referred to one of these groups, and it's something that would be helpful to you, that's something that I would recommend you bring up with your provider, and we can probably refer you. I know we've referred directly before, if you haven't had neuropsychological testing. Am I right about that, Dr. Kim, that's okay for us to refer directly to you guys for those?
Absolutely. We
Wonderful.
love referrals from Dana-Farber. Yeah, absolutely.
Wonderful. Great. Well, thank you so much for providing this amazing overview on the approaches for cognitive preservation for brain tumor patients. It's such an important issue. I'm really happy to have you here today. I want to switch gears a little bit and answer some questions from the audience. So we'll just start here with this first one that came in. This might be simple, I'm hoping. Is eyesight considered part of cognition?
Absolutely. So we may think eyesight is something very, very simple, but eyesight in our kind of thinking process can be very closely related. And so visual perception does play a very significant role in how we process and interact with our environment. So poor eyesight can, of course, impact our cognition in a few different ways. It makes it difficult for us to pay attention and focus, but also make it more difficult for us to remember if we're not able to have that acuity. It may also make it difficult to process information that comes through us in a visual way, right? Whereas if you hear something and you don't have any hearing problems, you may be able to remember and pay attention better. Now, eyesight is related to aging too, right? So as we age, both our eyesight and cognitive abilities may decline. And so conditions like cataracts and macular degeneration can exacerbate sometimes cognitive issues. And certain neurodegenerative conditions also impact eyesight in a few different ways that we can pick up on neuropsych assessments as difficulty with spatial reasoning. And that can be early indicators of certain neurodegenerative conditions like Alzheimer's or dementia with Lewy bodies, things of that nature. So yes, eyesight is considered part of cognition. But more than just simple eyesight, how we integrate the world and visually process the information and how that has a downstream impact on our thinking and dealing with information that comes through us through visual information is how that's impacting our cognition.
Very interesting. I said I thought it would be simple, but nothing is simple in this area. It's really helpful to hear you explain how all of these things are connected. And that information you just gave about kind of an eyesight test giving way to a possible diagnosis is absolutely fascinating. So thank you for that food for thought. A lot of things to think about. Let's see. This is a good one. How do you approach talking with a patient if you feel their cognition might be declining? At what point would this impact, and this is a question that, you know, it might be tough to answer, but and could be different for everyone. At what point could it impact independent living? So those are two questions. Approaching
Two great
talking to
questions.
somebody,
Yes,
yeah, and then
absolutely.
independent living
Yeah.
risks maybe.
So the first question is, how do you approach someone about your concerns about their cognition declining? So oftentimes when we abruptly approach someone and say, "Oh, your thinking skills are not very sharp," people may be very, very resistant, right? And so one of the better way to articulate that, in my opinion, as a psychologist, is um, first learning more about, do they have concerns? Have they noticed any changes, and gather more information. And with that, you can follow, if you are interested in having that person receive a full workup, including a neuropsych assessment, you can have a conversation about, having neuropsych assessment as a way to characterize both strengths and weaknesses, and not just a way to find faults and problems. Another way to think about this is, as is the case with any part of our body, our brain is part of our body that needs a checkup, just like when we get an annual exam. And that's not something that we regularly get a checkup on. So it's a good idea to get a baseline, even if the person does not uh, think they have a problem. And so uh, framing this as a kind of a checkup of the brain, as opposed to, what is wrong with the brain, is a good way to make it a non-threatening introduction to kind of having that person evaluated for any cognitive changes. So that's the idea that I have. And remind me the second question.
So the second question is about independent living. And I think this person is asking kind of, at what point would you have concerns about somebody living independently? You know, if you're noticing cognition challenges, let's say.
Yes. And this is a very, very important question, because uh, your ability, one person's ability to function independently as well as they have been, is really a key indicator, key criteria for diagnosing someone with dementia, right? If you are still independent, if you are still able to do the things that you used to be able to do just as well as you have been, then there's no dementia, concerns for dementia. On the other end, if there's cognitive disability, cognitive changes, cognitive decline present, combined with independent functioning decline, we call that dementia. And dementia is just an umbrella term to say this person's functioning is impacted in addition to objective changes in cognitive skills. A few indicators to be on the lookout for to think about changes to functioning is difficulty in managing their own medications or finances, and difficulty operating different tools, including microwave, stove, computers, and smartphones. Those are some common experiences that when people start to have changes in their day-to-day functioning, those are often what's impacted. And so what you commonly hear is that I was making a lot of mistakes, and now my family has to step in and double check. And also, I forget to fill my prescription medication, so I need a lot of help on those. Or I'm making mistakes on my taxes, so now I delegate that to my wife or husband or my children. So these are some commonly experienced functional changes that signals maybe there's something more.
Great, thank you so much. Yeah, I think, you know, it's different for everyone, it sounds like, but if there's something that you're not able to do that is something that really is required to keep you safe, you know, that's a time maybe when there would be concern. Um, and, you know, I wanted to just quickly go back to what you were saying about kind of talking to somebody about cognition, and just reiterate, I think you started with asking a question to the person, do you have any concerns about your own cognition? Even if someone doesn't, though, it sounds like if there's an outside party that's maybe concerned or just in general is looking to get more information about their loved one, or you are if you're a patient, um, getting a neuropsychological evaluation is really good information to have, even if there's nothing going on. Maybe you could discover that you have, some strength in an area you didn't realize. And then also sounds like, you said the word baseline. We think about that when we're thinking about MRIs in this department, right? But it's good too to have a kind of measurement of your cognitive ability so that later on, if something does change, you would be able to say, okay, things are looking a little bit different now. Maybe that would help with targeting that area or something. So I'm glad you brought that up. All right, let's see. We have a couple more questions here. This one is a little bit related. Somebody is talking about their experience with other people witnessing cognitive issues. So they said they lost their filter and they've been, fired from, it says 4 jobs for bad language and decisions. So it sounds like, some behavioral changes, but this person doesn't feel that they have issues with memory, is specifically what they mentioned. So kind of similar issue, but I'm wondering, they're asking about disability here. Is this something that you typically deal with? People who come in, let's say this person would come in for testing and they're not able to keep a job, and you find something on the test that maybe could explain some of these behavioral changes. Do you have experience with people getting disability? And I know it's kind of a tough area, but people are wondering about that a lot, I think, in our department in general. So
Mhm.
how does
Yeah,
that go in terms of cognition, issues with
absolutely.
cognition?
Yeah. So this is a tricky one to assess uh, with measurements that we commonly use because it's not a very simple ability. It's definitely a lot more complex ability that um, is not easily measured, right? How do you behave in social situations? How do you respond? How do you control your emotions? More often than not, in reality, neuropsych assessments do not often look at these kinds of social behaviors. Instead, what we do is take a good, careful history of the timeline and the quality and the changes and symptoms and say, we can yoke the changes to the tumor or the treatment following discovery of the tumor, and therefore most likely this is related to the changes that this person experienced. That said, there are a few different instruments that does measure what we call social cognition, our social behavior, our social perception. So sometimes those are measured, but more likely than not, the most important thing is careful history taking and correlating that to the timeline of when things happen. And so, yes, we are able to say with some confidence based on those information, likely that those are what's causing this. Now, of course, there are other factors that could contribute. If a whole host of issues started with the tumor or the changes related to the treatment. For example, sleep difficulties, maybe more depression and anxiety. Those can also exacerbate those symptoms. So often it's difficult to completely tease out those factors, but it is possible to say, yes, likely the impact of these changes in the brain and in treatment is influencing this person's kind of personality change or behavioral change.
Thank you. That's very helpful to hear about, the way that the social kind of components are considered. It sounds like, at the end of the day, maybe a recommendation for this patient would be to seek out neuropsych testing if it's something that they can have, and go from there and have a discussion with their provider about this. I also want to mention that we had a webinar last year about disability specifically with another program in the Center for Neuro-Oncology, just to the person who asked this question. So I'm going to also include that with the links at the end of this webinar, so you can learn a little bit more about disability and the different types of support that you may or may not be eligible for. We have somebody who is wondering how to get a test, a neuropsych test, and I'm just going to say, if you are, a patient at Dana-Farber, it looks like this person is, we refer all the time. So your neuro-oncologist or your team with us at Dana-Farber can refer you to Dr. Kim and his colleagues at the Brigham and Women's for a neuropsychological evaluation. So at your next visit, or if you don't want to wait until your next visit, you can always call us and just let us know that you'd like to be referred. And typically it's pretty simple, and there may be some, insurance checks, and then you would get scheduled for something. Does that sound right, Dr. Kim? Anything to add there?
Absolutely. I think we typically get our patients our referrals from either neurologists or from the specialty hospitals like Dana-Farber or Spalding, those kinds of places. So a referral is what we usually get.
Wonderful. All right, we have 2 questions here about sleep. Now, you kind of mentioned sleep as something that supports cognition, but people are wondering if there's anything, a supplement or a vitamin that supports sleep. I know this may not be, your area, but um, also healthy methods for improving sleep. Any thoughts there?
Yeah, so the supplements, I'm not really able to comment on that because I do not have the knowledge or expertise. But in the area of what we can do to improve sleep, I can tell you a little bit about that. So there's actually quite a bit that goes into our sleep quality, what we do before, what we do during, what we do after. So uh, and we call this kind of sleep hygiene, right? So there's a lot of things that we do, including screen use before sleep, right? So a lot of bright lights and screen use can really deter our circadian, what and fancy way to say our sleep cycle, by inhibiting, secretion of certain hormones that promotes, drowsiness and sleepiness. In addition, your sleep environment can also impact. Uh, and so all of these things, and also including, if you are someone with undiagnosed sleep apnea, or you snore a lot and you are interrupted in your sleep due to breathing difficulties, that can really fragment your sleep. So further evaluation and treatment of that can be helpful. We do have a program where we teach people different best practices around that sleep, and Dr. Kim Wilment, our director of our Renew program, actually offers that. And so if you have some specific concerns or really motivated to improve your sleep, and you are thinking that is a big part of it, we can certainly accommodate patients who are looking to improve behavioral changes that could help get better quality sleep, which is a very important factor for our optimal daytime functioning.
Wonderful. When you say that she addresses it, does she happen to have a group on it that you run, or is that something? Yeah,
Absolutely. Yep. So
great.
it's called Cognitive Behavioral Therapy for Insomnia. And insomnia in this case means just any kind of sleep issues. And so
Great.
other than kind of mechanical issues, organic issues like sleep apnea, a lot of things that we can still correct and change can certainly improve sleep. So what I've heard from anecdotally from patients who go through this is oftentimes they are going in pretty skeptical and they come out thinking, wow, this has really made a meaningful change in my sleep quality and I function so much better during the daytime.
Wow, great to know that it's available. Like I said before, I'm going to put a link to your website so people can look into the Renew groups a little bit more. And also, please do bring it up with your providers if you're interested, and we can see if we can get you connected with Dr. Kim and Dr. Wilman. All right, another question about lifestyle, foods to avoid. Anything that you would say is not great for cognition when it comes to eating?
Absolutely. So it is remarkably um, remarkably similar what is recommended for brain health, what your cardiologist recommends for heart health. So what is good for your heart is good for your brain. And it's not surprising because our brain is made up of a lot of tiny blood vessels, right? So pumping fresh, oxygen and keeping our blood vessels nice and clear and well flowing with blood, those are all very important factors. So we did talk about some generally recommended diets, so the Mediterranean diet or the MIND diet. So if you have any underlying health conditions like blood pressure, high cholesterol, diabetes, very important to adhere to diets that are recommended for those conditions. So if you have high blood pressure, low sodium, if you have cholesterol condition, making sure you're not taking in food that causes you to have high cholesterol. But generally good recommendations for everyone, regardless of age or condition, avoiding processed food and food that's high in sugar content. So those are very, very helpful. And also, one last thing that I would add, even though this is not, I guess, food, it's more drinks. One question that often people have is, a glass of wine, is that helpful? Latest research suggests no amount of alcohol is actually helpful, which is kind of surprising because for many, many years we thought a glass of wine is helpful for the heart, but that research apparently was a bit faulty in the interpretation because it was looking at the data in a kind of a little bit of strange way, where people who were drinking wine was drinking wine because they were healthy and were able to tolerate it. People who stopped drinking wine, who got worse, and interpretation based on that was people who could drink fare better, but that's because their baseline health was better. And so there was a little more complexity to that data. But short, conclusion to that long story is um, alcohol is not thought to be helpful for heart. Of course, if you enjoy it and you're generally healthy, it's probably okay. But for long-term heart health and brain health, uh, alcohol is not thought to be generally helpful.
Great. Thank you so much for going over that, and Dr. Kim for this comprehensive discussion that we've had today on cognitive preservation in brain tumor patients. Any take-home points that you would like to leave for our audience here?
Sure. I want you to remember, while cognitive changes and challenges are part of dealing with brain tumors and treatment-related effects, there are effective strategies to help manage and improve these issues. So patience and persistence with the right interventions can certainly lead to significant improvements, and we describe some of them, including interventions that we offer through the Renew program. Another thing to keep in mind is think about focusing your effort on what you can control, like maintaining healthy sleep, staying active, engaging in intellectually stimulating activities and socializing. All of those are proven to be helpful to promoting brain health long term. And these efforts can certainly make a more significant difference in preserving your cognitive function and in enhancing overall well-being.
Wonderful. Thank you so much. I've learned a lot today, a lot to think about. And as Dr. Kim and I both mentioned, if you have any questions about your own health or your own cognition, first place to go is probably, a provider, your PCP or your neuro-oncologist. And then potentially, if you haven't had neuropsych testing, that could be in your future if it's something that interests you. In addition to the testing, we're so lucky to have the resources that Dr. Kim and his group are providing through the Renew group. I will be putting their website in the chat in a moment. We also do have a poll that we're hoping you can all fill out at the end of this. And also remember to register for our neuro-oncology wellness program emails to receive information about our future webinars. So I'm going to paste several links in the chat right now. But again, I just wanted to thank Dr. Kim for coming on here and giving his expertise in such an important area that I know many of our patients are very interested to hear about. So thank you, Dr. Kim.
Thank you for having me.
Yeah, thank you so much, Dr. Kim. Thank you, Rachel. That was a great comprehensive program, and I'm honored to be part of it. So thank you. As I mentioned earlier, this session was recorded and it will be posted on our Blum YouTube playlist. So please keep an eye out for that.